So in this video, we'll discuss about bundles of care for catheter associated urinary tract infection, how to prevent Cauti, what are the practice that we need to bundle. Let's start with the intervention. So, okay, intervention that we would not eliminate. What else? Hand hygiene, followed by shift needs assessment. Next, need to ensure proper placement of device, after which we need to take into consideration that pericare needs to be ensured, and lastly maintained closed system. So what are the practice we need? Hand hygiene, shift needs assessment, proper placement of device, pericare, and maintained closed system. Now we discuss one by one in detail. First one is proper hand hygiene was proven cost and effective in eliminating microorganisms like bacteria and viruses that leads to healthcare associated infection. Okay, this one is prevent that Cauti, simple hand washing, that okay, hand hygiene, eliminating microorganism, this will prevent Cauti. Second one is shift needs assessment. Here insertion of indwelling catheter must be performed only if indicated. In addition, leaving it on place only as long as needed. We need to put into detail that minimizing urinary catheter use and its duration is vital. Prolonged catheterization can lead to high risk for Cauti and risk for mortality, and this is significant to women, elderly, and impaired immunity, okay, with patient. So this one increasing mortality for women, elderly people, and patient with impaired immunity. Then take notes if catheter is not needed. If catheter is not needed, do not placed one. Okay, no need means do not placed one. Then avoid use of urinary catheter in patient and nursing home resistant for management of inconvenience. So avoid of use of urinary catheter in patient and nursing home resistant for management of inconvenience, incontinence. Third one, use urinary catheter in operative patient only. Okay, use only operative patient as necessary rather than routinely. Necessary means we can use. Next one is operative patient who have an indication for an indwelling catheter, remove that catheter as soon as possible post operatively within 24 hours unless there are appropriate indication for continuous use. So within 24 hours possibly we can remove. Next, intervention and prevention of Cauti, that is placement of device. We need to understand that we should place the device securely. Dubbing must be free from kink. Needs to clip the bags properly to prevent kicking. Okay, so needs to clip that bags properly to prevent kinking. Next, keep it dry, clean, intact. Clean, dry, clean, intact. drainage bag or urine bag. Drainage bag or urine bag must place below the bladder at all the time. Do not allow the urine bag to rest on patient bed for prolonged period of time. This will leads to clogging, that will leads to accumulation of microorganism, bacteria and other infectious agent. So proper placement of device, we can place it securely. Then dry clean intact. Place urine that bladder urine bed below the bladder at all time. Do not rest that urine bag to rest on patient bed for prolonged period of time. Fourth, intervention or management. We have pericard. First, let's define it's this perineal care is usually called pericare. It means washing that genital in anus area. Pericare can be done during a bath or as a separate procedure. Pericare prevent skin breakdown of perineal area, itching, burning, odor and inflammation. Pericare must be performed minimum once per shift, even okay, perform minimum once per shift, even if your patient has individual catheter device, and not forget that educating patient and supporting groups such as family about necessity of pericare, and it is compliance to promote infection prevention is a must. And for the last entity of this catheter associated urinary tract infection care bundle, we have the maintained closed system. Last one is maintained closed system. Maintaining this durability, its objective continuously maintaining closed drainage system is indispensable of infection preventions of our device, except when irrigating that catheter. When it causes irrigation, applying applying leg bags for continuous bladder irrigation. More frequently disconnect the device. The more frequent we promote entry of multiple causing agent that leads to acute infection.